that the next, thank you, Ellen, the next 50 to 60 minutes will be devoted to really going through an applied case of how severe weather can severely limit the physical circumstances that we are obligated to as healthcare providers, and how we are really beholden to the climatic and environmental conditions to do our job, at oftentimes, paradoxically, when it's most important. So this is really crucial and kind of an exciting way to think that we often don't have much practice doing. Besides, unless you're ever in the situation, which hopefully you never are, but we will get out ahead of it today. So we will go through the focus of today, and we're going to introduce you to a case that's been constructed to try to help simulate a severe weather event and how this may impact and expand your role as a healthcare provider to help respond to this disaster. We're going to break out into small groups. We'll determine the exact size of those groups whenever the time comes. Probably won't be more than 2 or 3 at this point. And we'll take 15 or 20 minutes to go through some pointed questions, and then we're going to reconvene in the last 15 minutes or so, discuss what kind of conversations, what kind of findings came from that conversation, and we'll wrap up the case together at the end. Finally, there will be a survey. Believe me, we've looked at it. It is completely innocuous and very, very quick. So we'll end with that before excusing ourselves for the day. So again, thank you again for being here. We are going to start the second session here for the GCCHE Climate and Health Responders course. Today's topic is going to be extreme weather and building system resilience and capacity. This is something that we've seen being extremely relevant recently in multiple iterations, and it really makes us appreciate that as healthcare providers, we are obligated to work in a large system that is actually quite humbling, requires a lot of supportive roles. Let's see here. Is there a Zoom link for the course? We can probably fish that up. Ellen, can you look for that quickly? Thank you, I really appreciate it. So to dive into it, my name is Eric Balaban. I'm a hospitalist in Pittsburgh, Pennsylvania. I'm one of the current Climate and Health Policy Fellows through the University of Colorado program. And most of my work is aligned with NOAA, the National Oceanic and Atmospheric Association here in America, along with several NGOs, including the Environmental Defense Fund. We work closely with the Office of Climate Change and Health Equity, and I do a fair amount of state-level policy work for Pennsylvania as well. And Ellen is going to be co-facilitating today's session with me. And so Ellen, why don't you go ahead and introduce yourself as well?
Okay, so first I'm posting the Zoom link for what we're in right now, if that's what you're looking for. If it's something else you're looking for, just put it in the chat. But I'm Ellen Townley. I'm a medical student in Phoenix, Arizona, and I am one of the students who started Medical Students for a Sustainable Future, which is a medical student network in the United States that works on climate change and health issues.
Outstanding. And MS4SF is a huge network here in America that does a lot of important work. So Ellen is quite seasoned at what she does. Today's objectives, I see them as 3 primary objectives that we're going to try to tackle. First and foremost, we're going to describe how extreme weather events and or disasters compromise health systems functioning. That's number 1. Number 2, we're going to identify ways in which healthcare facilities can become more resilient to face the increasingly severe and or frequent climate-related weather extremes. So a lot of adaptive discussion there. And then finally, we're going to use emergency planning skills to plan for and respond to climate-related extreme weather events or disasters, including workforce surge needs, and to distinguish the complex interactions between agencies and systems involved in effective emergency response. Again, we're going to go through a case. We're going to read this case right now, and then we will pair everyone into small groups for, we'll say, about 15-20 minutes. It depends. We want to make sure this is a constructive conversation, but we also don't want to be disrespecting any time if we've accomplished what we need to accomplish. So Ellen and I will be checking in with the small groups as you work through a question that will be individually assigned to the small groups. And then in the last 15 minutes, we'll reconvene as a large group. We'll reflect on discussions and any kind of concrete answers or relevant sources or tools that each group is able to find. And we'll wrap up the case and conclude with the survey. And looking ahead, Ellen, I'm seeing that we have 13 participants. So my thoughts are 3 groups of 3 and a group of 4. Does that sound serviceable to you? Mm-hmm. Perfect. Okay. And I will go through the case unless, Ellen, you're able to multitask that and the room assignments, because I know you're better at that than me.
Sure. Yeah. Go ahead. Go through the case and I'll just set up into groups.
Perfect. Okay. So, ladies and gentlemen, we are going to be discussing an extreme weather case study. We are going to be assuming a position in Puerto Rico in the year 2022. So present day Puerto Rico. And we are going to imagine a scenario where just yesterday, a Category 5 hurricane tore across the island, and you have been selected to join the Emergency Disaster Management Unit. So this is the current situation. The entire electrical grid for the island is shut down due to storm damage. Your hospital has a backup generator allowing only for limited patient services, but fuel is scarce and finite. About 80% of the hospitals on the island are closed as well due to damages. Telecommunications are extremely limited and non-existent in most areas. Many roads, especially leading to remote communities, are impassable. Much of the local crop productions, such as bananas, coffee, and citrus, have been decimated. Islanders have lost their homes, their jobs, their way of life, and many have lost family members either due to direct damage from the storm or from subsequent health issues. The emotional toll of the storm has had on the emotional impact that the storm has had on people is incalculable. People are evacuating, but the process is slow. Staff shortages in every industry are immense, but particularly within the health industry. It seems that the system is so fragile, it is on the verge of outright collapse. There are hundreds of thousands in need of medical care. Conditions for aid workers are dangerous, and the death toll is still unknown. This is reminiscent of course, Hurricane Maria just a few years ago, where the death toll was originally thought to be 65 and quickly blossomed into several thousand. So this is certainly not a theoretical situation at all. Your mission is the governor of Puerto Rico has asked your team to establish a list of 5 priorities for caring for the health of the island, and asked you for an action plan to present to the news media on the evening's broadcast. Work with your team and establish the most likely essential needs and how they might be addressed. So what we're going to do, and all that you will have in your individual Google Doc, that should be posted in the chat. If anyone does not see the link to the Google document, let me know. But it should have, yes, I will repost it. Great. You betcha. I'm going to repost that right now. All right. So right there should be the Google Doc. That will have the case and the overall mission. We're going to split people into 4 groups, and each group is going to have a unique question. Questions 1 through 4 for groups 1 through 4. The group title is a hyperlink that you can then use to take notes on whatever your team finds constructive or interesting through the course of your discussion. So once we split you into groups, please refer to that document and answer your individual question. We ask for 2 sources, but any sources or tools, you're not limited to 2. And if you scour the internet and only find 1, that's okay too. But do try to jot down some of those points. And so when we reconvene, we can have a fruitful discussion on how dividing and conquering the aspects of a very complicated situation can be approached.
I might force their hand a little here and close their room so we can have a group discussion. So we'll see. Okay, I guess it warns them, so they're coming. All right, welcome back. You're muted, Eric.
I know there has to be one person to do that in every Zoom meeting, so
Mhm.
it's the burden I carry. We Yvonne had to go to a prior engagement, but we should be all here. Excellent. So everyone, let's it looks like we have about 10 minutes left. Let's walk through these questions together and just recap briefly what were the answer, what was the answer, and any salient discussion point summaries. So question 1, Ellen, do you just want to go through the 2 questions that you guys had?
Yes, so we ended up with 2 groups. So can Julie and Joseph, do you want to take us through your question? And they put some of their resources in that Google Doc that's available in the chat.
Julie was a much better searcher than I was, so I think she should share them.
Okay, I'll be glad to. Hi, everyone. My name's Julie. I'm a nurse who's actually found out about this through one of the resources that we chose to use. So our question was, what populations are most vulnerable? So we thought of the social people with the social determinants of health. We thought of the age extremes, infant and adult. And we also thought, since this was a hurricane, we thought of perhaps people who may be living coastal, who are more apt to be flooded. Also, those who don't have good social networks, and people with chronic diseases who may not have been able to receive the medical care since most of the facilities were closed. And with a hurricane, I'm also thinking dialysis patients, because they need the water and they need the generators to make the dialysis machines work. And that's never, a priority, but that is an at-risk group. So our resources that we thought, ironically, I'm in Minnesota. And so when I typed it in, the Minnesota Department of Health just came up with a quick website. They actually do some great education. And so, and they're very big into diversity and inclusion. So the first one, this Health State of Minnesota, was a good article. The second one from the United Nations is a 2019 document. And it actually talks about vulnerable cities with a global map. And ironically, I saw that Columbia University was involved in that study. That's about 27 pages deep. So that would be a deeper discussion. And then the third site is a free e-textbook, which is envirn.org. And that's actually put out by the Alliance of Nurses for a Healthy Environment, ANHE.org, and they have great free resources, and they'll have hyperlinks to massive articles in there. So if you're able to click on that, it comes up like the page, and then the book is underneath it. But type in, and if you get to page 113, it really talks about the different groups that we just kind of discussed. It just validates what we said. That's all I have.
Thank you. And if you want to add any more notes, I tried to start typing what you said, and I don't think it was complete. But group 2, do you want to talk about your question and what you came up with?
And Ellen, I think that was, we were groups 3 and 4, I think, right?
Yes, you were.
Okay.
For group 2, Sorry, hold on one second.
Mhm.
So our question was, what sectors could you partner with to achieve your goals? And so in first talking about our priorities, we determined rescuing individuals from unsafe conditions, food and water, shelter for displaced persons, healthcare and social support to be our main priorities. And some sectors to partner with were housing, social services, food and water systems, healthcare, education, energy, public safety, telecommunications, public infrastructure, and waste management. And I did not find any resources yet. I'm not sure if anyone else in my group had any.
Yeah, you know, there's a lot of good points there, and some of them actually tie into one of our questions, which we discussed a little bit, but we think about what the health concerns, what the priority health concerns of this disaster is going to be like. It kind of dovetails with what you said there, with particularly with waste management, because that's going to be a bigger and bigger problem moving forward. Any other thoughts from your group regarding that question?
For group 2, I think that was it.
All right, sounds great. Thanks so much, Rebecca. And excuse me. So for group 3, we talked about how hospitals and public health departments, how hospitals and public health departments can respond, what guidance they might offer, and how that guidance would be given, what kind of communication points would be important to consider. And Wilma, I know that you were taking a few rough notes. What kind of highlights did you take away from that?
Yeah. So the first keynote was already answered. One of the key things is we have to identify who are the most vulnerable. And thank you for group 1. You've done the job for us. One of which is there may be a need for more space for triage, as well as we have to identify which are the life-saving equipment and what condition, what effects they may have under those circumstances, and how do we protect them. And then we also talk about where to get additional resources, including perhaps the use of public health department staff to step up to provide medical services. And then like also identifying what personnel would be most needed and to handle the emergency, and how do we share so that we can expand the services that may be most needed most. And then about sending out communicating the messages, we have quite a bit of discussion. We think that it's most important to have a trusted messenger to communicate the critical messages, and using a one voice communication. Since it's a situation where the staff themselves would also be very stressed, and some of them may be scared because they have situations to deal with personally in their own family and also at work, and they may be at half the efficiency. So how do we like get everybody together to focus on the things that we have control over, and let people know that remind people that those are the things we have control over, and that what we are doing. We may also need to, through communications, help to triage so that less people that may not need the service of the hospital would have somewhere else to go, or some other solution without going to the hospital. So that we also talk about that there is a balance that's necessary in keeping people informed, but not triggering panics in people. So like in general, there's something not to be done at the moment, but that we feel that there's a need for public health staff to be trained in skills of outreaching and with more customer services and understanding how to provide some of the communications. As to what may be some of the public health concerns. We feel that like mental health is one of that. We really feel that try to keep the I don't know the medical term for it, but like the PTSD and things like that, to be really tackling them at the early stage and not let it deteriorate or aggravate over time. And then some of the things that really help to prevent more stress for people is really looking after food and water, those basic needs, but also those are things that will help if we ensure that they are safe, then there will be less health concern following that. And then we also feel that providing people with a sense of community would also be important if there's a way that we can use the limited medical resources we have to helping neighbors build a sense of community. That would be great. So that's our discussion.
Excellent summary. Thank you. I think two salient points that we kind of chatted about was how when it comes to communication, this is so not a theoretical concern, because when I reflect on the COVID pandemic, this is we'll call it a disaster that has really challenged science communicators who usually don't need to communicate this way to the public. How do you walk that line between conveying unclear worries, information that you know, and information that may be volatile, that may scare, dishearten, or upset people? How do you do that well? I think one of those things, and there's no clear answer to that, obviously. I think focusing on what you have control over and what proactive steps are being taken to help instill a little bit of confidence or sense of control is going to be important. Let's see. So that all is an excellent discussion and review of what we talked about. Regarding the sources, I did put in the Google document within the communication portion. There are actually some really interesting peer-reviewed things. I put in a packet that was recently published out of the UK government, actually, that are some guidelines, some tricks and tips that helps people in the healthcare sector and how to communicate well. And even more user-friendly resources. Eco America's packet, it's like, I want to say it's 15, 20 pages, but it's very user-friendly, that talks about how healthcare professionals can communicate well with respect to climate change specifically. So maybe not necessarily disasters, but there's a lot of tips in just general communication there too. And then of course, with the emergency health concerns, the CDC, Centers of Disease Control, has an entire health professionals and healthcare subsection in their website to discuss more about that. So excellent. We've collated research, the resources and tools. Any last thoughts? Because I see that we're closing in the last 3 or 4 minutes here, and we want to make sure that we save 1 or 2 to answer a few questions in that survey. But any culminating questions or thoughts for the betterment of the group? Yeah, Julia, I couldn't agree more. We were actually talking about how you might even frame the risks and guidance that you give other systems that you work with, like what we would call in the healthcare system the acute and the subacute or chronic concerns. The acute concerns are going to be your traumas. It's going to get triage. How are you going to expand your triage center so you can see patients and give who needs what when? But then after you take that initial brunt, and those who survive, and those who don't die, you enter this phase of emotional health, of food, and of water, and trying to stem more emergencies from happening when you're in this very vulnerable recovery period. And a big part of that sanitation. Good point. Any other points, comments, questions, concerns? All right. Well, I want to make sure that we're respectful of everyone's time. And again, we so enjoy your participation, and thank you for your attention to such an important topic. Ellen has just posted a hyperlink to a survey. Again, I promise it's short and innocuous. If you guys would do us the favor of briefly completing that, we'll call it a day.